Who do you trust for information about health and medicine? Do you trust your doctor? Do you trust a politician? Do you trust someone online? I'm Dr. Chad Swanson, and I'm on a journey to understand and transform our health system. This is my daily health systems transformation video. I consider it an informal conversation about transformation of our health system because I think it's gravely needed. I recently watched a video with this doctor, Dr. Mike. I have absolutely no ties to him whatsoever. I just discovered him a few weeks ago, and then he was interviewing Dr. Marty Makary, the author of a book that I think 2/3 the way done or something, called Blind Spots, which I strongly recommend. And this interview really has to do a lot with trust in health and medicine and communication, so effective communication. So on the one hand, Dr. Makary, very respected pancreas surgeon, I believe, at Johns Hopkins, very accomplished as far as academics are concerned. He's also written a number of books. He's quite remarkable in how prolific and accomplished he is. But he's also a bit of a contrarian or a gadfly. I think he's pretty effective at pointing out ways that we as a medical establishment and society as a whole have misinterpreted science and provided absolutist recommendations. So a few of those would be the recommendation that young children don't be fed peanuts. So that's something that likely contributed to the high level of peanut allergies. He talks about hormone replacement therapy in women. He talks about neonatal care of young infants and how that's changed over time. And his point is that, if I can try to summarize it, that we as physicians and as medical societies are human beings. We're deeply flawed. We engage in groupthink. We have agendas and want to further our cause, even if the science isn't necessarily that strong. And I tend to agree with that strongly, that as a medical establishment and as a profession, we could have and still can do much better at sticking to the science as opposed to pushing recommendations that may not have very strong science. Now, Dr. Mike, on the other hand, very popular, a family practice doctor, and he seems to provide the message that while there have certainly been a number of reversals and corrections in science and medicine, for the most part, we're moving in the right direction, and that's the way science should work. We should base our recommendations on the best evidence and then correct that when better evidence comes along. Both of them talked about the importance of communication and how today there's too much polarization. I definitely agree with both of them that we as a society, and that starts with medical profession and public health professionals, need to do much better at communicating science. By that I mean there are recommendations that are based only on the opinions of experts, and there are other recommendations that are based on very solid science. And there's types of scientific studies that we can determine that based on. And there's actually a hierarchy in scientific studies. And I think it would benefit society as a whole if much more of us were conversant and understood that hierarchy, and we were able to communicate that in an effective way. I'd love to know your thoughts. Who do you trust for scientific information? Do you have experience with Dr. Mike or Dr. Makary? Have you read the book Blind Spots? I'd love your thoughts and comments. Again, this is an informal conversation, so I'd love your feedback, criticism, and I'm happy to correct anything as needed. Thank you.